happens in a heartbeat, sudden cardiac arrest, claiming thousands of lives each year in Hong Kong alone. Without immediate intervention, only 2.3% will survive. The earlier you give CPR, the better the survival chance. But CPR is not the only answer. Only a defibrillation shock can reset the heart to normal rhythm if administered in under 5 minutes. When you come across someone who has collapsed, make sure the scene is safe. Then see if he or she can respond and is conscious. Then, if the patient does not respond, ask your colleague to call 999 and run to find the nearest AED.
999報案中心啊，麻煩你呢度有人暈咗，麻煩你幫我 call 救傷車過嚟好嗎？我會返嚟嘅喂，快啲啊
Remember, every minute counts. Next, check if the patient is breathing. If the patient's not breathing, you should commence CPR until your colleague returns. Please note, if you are alone, first check to see if the patient responds and is breathing. Then call 999 immediately and leave the patient to locate the AED yourself. Be fast. Every minute counts. In summary, when you come across someone collapsed, check if the scene is safe before rescue. Check the victim's response. Call the 2 A's, ambulance and AED, and check if the victim is breathing. If not, start early CPR. Take everything in the AED box with you, including mask and ready kit. When the AED arrives, open the lid immediately. This will switch on the AED and it will then give clear instructions.
Remove white square package from lid of AED.
Stay calm and follow the voice instructions. At this point, you can easily change the language of instruction from English to Cantonese by pressing the Change Language button. Begin by exposing the patient's bare chest and torso. Then, open the square foil package. Separate both pads from the blue liner and place them on the patient's bare chest in the positions illustrated.
Next, peel second white pad from the blue plastic.
Make sure the pads are firmly pressed down.
Do not touch the patient. Analyzing rhythm.
Please note, the Powerheart AED G5 is fully automatic. It will only deliver a shock to a patient if needed. You do not need to press any button, therefore you cannot accidentally shock someone. For instance, if the AED detects a positive change in the heart's rhythm, the AED will automatically cancel the shock.
Do not touch the patient. Analyzing rhythm.
Stand back from the patient and allow the AED to analyze the heart rhythm.
Shock advised. Do not touch the patient. Shock will be delivered in 3, 2, 1. Shock delivered.
Once the shock is delivered, you will hear the following instruction.
Start CPR.
Compress the chest to a depth of 5 to 6 centimeters at a rate of 100 to 120 compressions per minute.
Give breath. Give breath. Start CPR.
Please note, if your AED also comes with a CPR device, the machine will prompt you to place the device in the center of the patient's chest. Continue to follow the AED's instructions until help arrives. You too could save a life with a swift, determined response to someone collapsing with sudden cardiac arrest. In summary, when you come across someone who has collapsed, is unresponsive and is not breathing, be quick. The earlier you start rescue, the higher the chance of survival. Call an ambulance, send for an AED and start CPR. Follow the AED's instructions until the emergency services arrive. For emergency service professionals, there may be a few changes to the protocol. You should also check for carotid pulse before commencing CPR. And if you have the semi-automatic AED, you can press the button to deliver the shock yourself, if preferred. If you are following the St. John's or Red Cross protocols, you should perform head tilt chin lift. Check for mouth obstruction and check for breathing by the look, listen and feel approach.